Here are 15 Puerto Rico Medical Board-style clinical vignettes focused on pulmonology, specifically asthma, COPD, pneumonia, and interstitial lung diseases, ILDs. Each includes a clinical case, 4 answer choices, the correct answer, and a brief explanation. Asthma exacerbation. A 22-year-old woman presents to the ER with wheezing and dyspnea. She reports using her albuterol inhaler several times with minimal relief. Peak expiratory flow is 45% of predicted. What is the next best step in management? A. Inhaled corticosteroids. B. Oral prednisone. C. Magnesium sulfate. D. Montelukast. Oral prednisone. Explanation. Systemic corticosteroids are indicated in moderate to severe exacerbations with poor response to bronchodilators. 2. COPD exacerbation. A 68-year-old man with a 50-pack-year history of smoking presents with worsening cough, sputum production, and dyspnea. Vitals, RR24, SpO2 88% on room air. What therapy is indicated? A. Inhaled corticosteroids only. B. Azithromycin, albuterol, and prednisone. C. Oxygen and Montelukast. D. Theophylline. Answer B. Azithromycin, albuterol, and prednisone. Antibiotics, bronchodilators, and systemic steroids are mainstays of COPD exacerbation management. Community-acquired pneumonia. A 55-year-old man presents with fever, productive cough, and pleuritic chest pain. CXR shows a right lower lobe infiltrate. What is the most appropriate initial outpatient treatment? A. Amoxicillin. B. Doxycycline. C. Azithromycin. D. Ceftriaxone. Explanation. Macrolides are first-line outpatient therapy for CAP in previously healthy individuals. 4. Hospital-acquired pneumonia. A 60-year-old man develops fever and cough 3 days after being admitted for a stroke. CXR shows new infiltrates. Which pathogen is most likely? A. Mycoplasma pneumonia. B. Streptococcus pneumonia. C. Pseudomonas aeruginosa. D. Chlamydophila pneumonia. Answer C. Pseudomonas aeruginosa. Explanation. HAP is often caused by gram-negative organisms like Pseudomonas. Interstitial lung disease. A 45-year-old woman with progressive dyspnea, dry cough, and fine bibasilar crackles. HRCT shows ground glass opacities and reticular infiltrates. What is the most likely diagnosis? A. Asthma. B. Sarcoidosis. C. Idiopathic pulmonary fibrosis. D. COPD. Answer C. Idiopathic pulmonary fibrosis. Explanation. IPF presents with restrictive patterns and characteristic HRCT findings. 6. Asthma diagnosis. A 30-year-old with intermittent wheezing, worse at night, shows FEV1 FVC 70% with 12% improvement after bronchodilator. What is the diagnosis? A. COPD. B. Asthma. C. Bronchiectasis. D. Restrictive lung disease. Answer B. Asthma. Explanation. Reversible obstruction is diagnostic for asthma. 7. COPD pathophysiology. A 70-year-old smoker with chronic cough and dyspnea. Spirometry. FEV1 FVC equals 60%, FEV1 45% predicted. What is the underlying pathology? A. Airway hyperresponsiveness. B. Alveolar destruction. C. Mucosal edema. D. Bronchial cartilage erosion. Answer B. Alveolar destruction. Explanation. Emphysema, a COPD subtype, is characterized by alveolar wall destruction. 8. Sarcoidosis, a 35-year-old African-American woman with cough and bilateral hilar adenopathy. Labs elevated ACE, hypercalcemia. What is the best next test? A. Sputum culture. B. Bronchoscopy with biopsy. C. Pulmonary angiogram. D. Answer B. Bronchoscopy with biopsy. Explanation. Diagnosis of sarcoidosis is confirmed with non-caseating granulomas on biopsy. 9. Cystic fibrosis. A 6-year-old with chronic cough, greasy stools, and failure to thrive. Sweat chloride is 75 mmol/L. Most likely mutation? A. B. CFTR R17H. C. Alpha-1 antitrypsin deficiency. D. Beta thalassemia. Answer A. F508. Explanation. F508del is the most common CF mutation. Pneumocystis pneumonia. A 32-year-old HIV+ man with CD4 count of 150 presents with dry cough and dyspnea. CXR shows diffuse interstitial infiltrates. Next step in management? A. Azithromycin. B. TMP-SMX. C. Fluconazole. D. Oseltamivir. Answer B. TMP. Explanation. TMP-SMX is first line for treatment and prophylaxis of PCP. 11. Asthma control. A patient with asthma uses his albuterol inhaler daily and wakes up with symptoms twice a week. A. Continue current therapy. B. Add long-acting beta agonist. C. Add inhaled corticosteroid. D. Switch to leukotriene inhibitor. Answer C. Add inhaled corticosteroid. Explanation. Daily use of rescue inhaler indicates need for controller therapy. Hash is 12. See oxygen use. A COPD patient has SpO2 of 86% on room air. ABG shows PaO2 of 52 millimeter Hg. When is oxygen therapy indicated? A. PaO2 60 millimeter Hg. B. AO 55. C. SaO2 95%. D. Only during exertion. Answer B. Explanation. Long-term O2 is indicated when PaO2 55 millimeter or SpO2 88%. Aspiration pneumonia. A 76-year-old nursing home resident with dementia and cough. CXR shows right lower lobe infiltrate. Most likely organism? A. Klebsiella, B. Pseudomonas, C. Anaerobes, D. Mycoplasma. Explanation. Aspiration pneumonia often involves anaerobic flora. 14. Hypersensitivity pneumonitis. A 55-year-old farmer with fever, cough, and dyspnea after working in a barn. HRCT shows ground glass opacities. Best management? A. IV antibiotics, B. Oral prednisone, C. Smoking cessation, D. Supportive care. Explanation. HP is a non-infectious allergic alveolitis treated with steroids. A 15E versus COP. A 60-year-old man with progressive dyspnea. PFT's decreased FEV1 and FVC normal FE1 FVC ratio. Most likely condition? A. COPD. B. Interstitial lung disease. C. Asthma. D. Bronchiectasis. Answer B. Interstitial lung disease. Explanation. Restrictive pattern with preserved ratio suggests ILD.